India, a country of 1.25 billion individuals, famous for its traditions and culture. Tourists have always traveled to this developing nation to experience the most ancient cultures in the world. While talking about tourism in India, you might be thinking of forts in Rajasthan, Red Fort, and Mughal history or the scenic beauty of Karnataka. However, in recent times, there has been a new kind of tourism on the rise in Indian hospitals. It's called medical tourism. Medical tourism is one of the most important segments of Indian healthcare. Currently, medical tourism is valued around a whopping $6 billion, making it one of the most opportune fields in healthcare sector in India. There are many hospitals in India accredited by authorities like NABH and JCI to treat foreign nationals under medical tourism. But first, let's know what exactly is medical tourism.
Some of the countries, they do not have access to the whole spectrum of medical care. For example, liver transplantation. It may not be available in a South African country or somewhere in the Gulf countries. So these are the patients, they do not have any access to a niche area in medical care, and that is when they want to travel to another country for getting a better medical help.
But why are so many people flocking to India for their medical needs? Is unavailability of treatment in the countries the only reason behind this? Well, with the increase in privatization of the Indian healthcare sector, the foundational infrastructure for healthcare has improved in the metros. Consequently, there are various factors that attract more medical tourists every year to the Indian hospitals. India offers one of the most cost-effective healthcare facilities all across the world, with prices almost as low as 1/20th of that in the US or the UK. For instance, if a liver transplant in the USA costs around rupees 1 crore, the same treatment in India will cost the patient just rupees 20 lakhs, even in the biggest of the corporate hospitals equipped with all the modern equipments. Patients traveling to India can save as much as 75% of the entire amount they will be spending on the treatment in any Western country, even after spending on traveling and lodging.
If you compare ourselves with anywhere in the world, we are at par with US, UK in treatment standards, and we have almost every facility what a person can get anywhere in the world, but our cost of treatment could be anywhere 1/50th to 1/20th of the cost in US.
Another reason why foreign nationals prefer India as their medical destination is the zero waiting period Indian hospitals offer to the medical tourists.
We are here for the correction of his both knees because he was diagnosed with Blount's disease.
So somebody travels from A country to the B country for getting better medical help for a couple of reasons. Sometimes it is not available. In countries like England or America, some of the surgeries waiting time is so long that people get frustrated. If somebody has cataract, for example, and this cataract surgery, if somebody is already not able to see properly, elderly gentleman or a lady, and they are told that because the waiting list is long, they have to wait for 6 months. It's a nuisance. And if they have access to another country where it can be done overnight, then nothing like that. So these are some various reasons why people want to travel to another country for healthcare.
For people in Western countries where patients need to book appointments months before their surgeries, even in critical situations, traveling to India where they can be treated immediately is a highly fruitful and beneficial option. Indian doctors also bring with them loads of clinical experience, which ensures the quality of the treatments offered to the medical tourists. In fact, Indian doctors provide their services to more than 1,70,000 medical tourists every year.
Yeah, it has been extremely good. I didn't know the hospital at all. I just happened to be here nearby, but then as soon as I was in, I had full trust in everybody, the doctor, the specialists, the nurses. I think it was because they were friendly, but at the same time they were decisive and very determined. They were very clear in what they were doing, and that gave me, I think, immediately the trust. That helped me a lot. The other thing was that I'm far away from my family and my colleagues, so I was in a way very lonely here. But with your staff, that has helped me a lot mentally, because people were very good spirit and humor, and so we had a lot of laughs together, and that helped me a lot to keep positive, even though my nearest friends and family, that they are very far away.
Traveling to India for treatment also provides the medical tourists with the opportunity to travel the country, spend some quality time with the family, and obviously visit and experience the grandness of Taj Mahal, which is one of the 7 wonders of the world. The Western Ghats, the Himalayan ranges can definitely make a patient's medical trip to India memorable. But how can an Indian doctor become a part of the medical tourism industry? Do they need any certifications to treat medical tourists?
The standard degrees or standard training which is acceptable by the Medical Council of India is good enough for treating any patient, whether it is our country Indian patient or patient from any other country. But suppose I want to practice in Dubai, for example, then I will require some accreditation in addition to my own training.
Once a doctor starts treating medical tourists, he should be very careful about the entire admission process of such patients and should pertinently follow the guidelines set by the National Accreditation Board for hospitals and healthcare providers.
The key points that the patient should be provided is basically the patient should be very well aware of where the patient is going to stay, how is transit communication, how is he going to communicate, and basically the language barrier also. The patient before reaching should have a clear itinerary of what his stay is going to be, from which date till which date, and who is going to take care of it. And lastly, but the most important, the patient should be provided a very clear-cut idea of the finances that he will have to bear here.
For medical visa and other required formalities, doctors should also remind the patients to carry all the important documents with them. It is important that these documents are checked and verified before granting the permission letters.
The patient firstly should carry all his medical documents, every evidence that he has regarding his treatment till date when he is supposed to come, and secondly he should be carrying his legal documents with him. These are the basic requirements which he needs.
People in India believe in the philosophy of Atithi Devo Bhava, meaning that guests are equivalent to God. Hospitality is one of the most prominent traits of Indian culture, and Indian doctors thrive to bring the phrase to reality in every aspect of medical tourism. Indian doctors are known for their skills and efficiency, and they work really hard to provide each and every patient with effective care clinically. India is proud to have such doctors. India is proud to have you.